Good morning, everyone. It is Friday, October 2nd. We are here to provide an update on the Hope Bay mine situation and general COVID response in Nunavut. Premier will speak very briefly. Dr. Patterson will give some remarks, and then we're going to go into questions. I ask that you do one question, one follow-up, and then we cycle through again, not a big bunch of questions. Thanks.
Hope Bay na bingani kami parlani ngani no badyo naktuloy ang balang lumabumino badyo naktuloy namo sibulat ko kali malawlo ni luta Patterson ang malo ministro kali malawlo ni ataw siya tuwing natin kay nahatang dalang ayo sibulat mo
Ublatsia Nunavut mute man natakwa uyata ni Hope Bay mines nitekwa nuban na yo 19 kadlo mga ta huli utak kayabut takwa kawi hang ningit kawin nangit huli kabluna nuna ni kawi hak tahu amamana mo ticket libu ta ko nungu ilwani 2981 kawi hak tahu himayo nuban na yo 19 kangi mangata 465 ta ko huli utak kaya buta kawin nangit huli watcha na ta na Dr. Patterson unikara na mata na uyakata Hope Bay mines kanwilang mga nuban na yo mikani kihani okakartit na gota okagaya wak Nunavut munut takwa Nunavut mute takwa huya kang mangata amma kanopiya kang kayang mangata takwa nanundayang na mata kablunano na ni takwa nuban na yung 19 kawin naksuni amatuhan na taksuni ami hungok padlianang ming mata tana nuban na yung tamani katana manalunang ito Canada mi hilang yami amatakwa inuhibud adjiw lang imatata hibunik kaptit itakwa tananuman na 19 tamani katana man amatana anari kuti kablunat vaccine kakupiani kamana mga kawin nangit luhuni kawin nangit huli kihani pilira yoyo amatakwa Pia kakayak tabuta ko uwap tini ilap tini pekam na tini tako nagligiyabut menere chalagu Iqaluit chalagu ta nuban na yo mikanut ila nuban na yo 19 kal talang imata amata ko ukaw herin na talaw tabuta ko agabo ang michak talawit amihulu alu ta kating ngin duta kinap pam atoluta atora kalangata takwa malit chela la watan nuban na yo 19 nubu ilon tikel to ayang na pat takwa malit cha op tigotan nuban na yo 90 ay to lang inapta ama angi lang isu nubu iloni
Is this on or off?
Going now? We start over again? Let me start over? Okay. Iqaluit tana ni pakalaw mago pigya kanilaw na migapta. Nunub miubla cheko pahi. Manata ko nuban na yo 19 taken ni uyata ni Hope Bay mines taken ni kawihang mata takwa Nunubu iluan na kawiyak tau mata nuban na yo 90 kang nagalaw mata kihani takwa kawihang ni ko kablunano nunano kawiyak tau kan nirato himang mata takwa tuhang nangit huli nuban na yo 90 kadluwig mangata Mama na mutikid lugo nunubu iluan ni takwa 2,981 Inuit kawiyak tau himayo nuban na yo 90 kang mangata 465 ni huli utak kayugo takwa kawin nangit huli nuban na yo 90 kangi mga ta. Watcha na ta na Dr. Patterson unikara na man takwa nuban na yo ta kani uyak ta ni Hope Bay mines kihani tabunga inga kakta na nunabung minut kagaya waktu nga ta ko nunabung minut kano pigya kakayang mga ta ila hugya kakpita amma takwa hulut ta takwa ino katibu ikayong na aptigut ta nuban na yo narano kawin naksuni ang batuhang naktaksun takaw nubun na yo 19 kablo na nunani angig libad lelang ming mat amihut yuit anya lak pa lelang mata Tan kawin na sunitan kawin na mas sunitan nuban na 19 tamani ka tana suni Canada iloni mahila yami ta ko inu hibut ajingi tu me pekko ni ato kaya kang ne apta tan nuban na 19 qaqti lugo amma kawin na ngit suni hulitan ana ri ku taqablu to vaccine qaku hanayo yang mangan amma tana hanayo qaqti ngo ta ko pekko hit atuin na lo to atu chedal lo ta ko aggabu yang mi cha ta lugit ami huluang itang ta katika ngata amma kina pamita taluang me atong luta atong kalanga ta amma ta ko ino katibu but nagligiya but pakanna but menere charlugit Iqaluit charta lugit tan kawi mahuitu kaila kawi man nalang imatan inna kutip tunit ay tolui tu loab ta ko malit chalaw labuta ko pekohit atok to ko law to tang anya qaqtayli chi kutni amata ko hunamiat atok to wayuk tu elmik talu ta ko hunamiat atok to wayuk tu elmik logita nuwan na ya tai kung na pat elmik pat per man tan nuwan yo 19 tamanya qatana mat qawi hat chaluta menere chaluta ta ko inokutit tinit nagligiyap tinit ay toloy lang inapta Nunavut miu ta tamna qawi hat chalaw labut amma Nunavut miu ubdokat chana ko he matna na alak ta pitana nubun na yo tamani ngi masuni huli Nunavut ilwani matna. Good morning. We are still awaiting confirmation results from the individuals tested at the Hope Bay mine. The total number of persons followed to date is 2,981. There are 465 persons currently still being followed. Before Dr. Patterson speaks about the situation at Hope Bay mines, I want to take a few minutes to speak directly to Nunavut Mute about our responsibilities, each and every single one of us. As we can see cases rising quickly in parts of southern Canada, it is clear that we are into the second wave of this virus. COVID-19 is nowhere close to being over. It will be part of our lives for the foreseeable future, and we don't know when there will be a vaccine or an effective treatment. So we all need to make sacrifices to keep each other safe. We need to change individual actions and behaviors and show our care for our neighbors and our community. Please remember, your actions impact everyone's health. That's why it's so important to follow the public health measures. Hand washing often, maintaining physical distancing, and frequently cleaning of high-touch surfaces. Following the gather size limits, isolating and wearing masks when you need to. COVID-19 means we need to think about others and their health and the safety now more than ever. It is still up to each one of us because what we do as individuals impacts everyone now. Thank you, Nunavut Mute.
Good morning. On September 28th, the Department of Health activated its rapid response team to contain an outbreak of COVID-19 at the TMAC Resources Hope Bay mine site. TMAC Resources contacted my office on September 26th about an employee developing symptoms consistent with COVID-19. The individual and identified contacts were swabbed and the sample sent to Rankin Inlet for testing. 7 of the initial samples taken this week yielded presumptive positive results, and all were sent to a southern lab for confirmatory testing.
My mic on? Is it on? Can you hear me? 1, 2, 1, 2, 1, 2, 3. It's good? Okay. September 28, Utilugo, Anna Hamna, Tulari, Kupiga, Fixila, Tuagan, Natukut, Iqaluit, Unita, Sama Palea, Hunagunuva, 19, TMAC Resources, Hope Bay, Yaramabingani. Team agrees was good young Natiku, how you kailok to Alabinic September 26, meeting Lugu, Kanayak Timigo, Kanu good to have to Yamat, Nuvajan of 19 Mik, Tan and Aluna Tolok, Amaloha, Katisima Yangi, how you Sapto, good it's an outlook to Tolok to Kakaya Cinema. That was 7 civil park, how you saw outside a Bonapina service of me, Sakko Tolok, the civil park, you make Naluna Towning in Nick, Nuvajan of the Hamning in Nick.
For the past week, the rapid response team has been conducting additional contact tracing and taking samples. As of last night, 5 more swabs were flown to Rankin Inlet for testing on the GeneXpert or BioFire devices. One of these swabs has tested positive and will also be sent for confirmatory testing. 3 yielded negative results and 1 is still pending, and another 8 swabs will be delivered to Rankin Inlet tomorrow. Okay. To accurately detect the virus, high-risk... Oh, sorry.
Umnula to Talimakan ni Hawi Sarachani, Kakakang Sinum, Alakito, Yahala, to Takunu, Hawi Sarapi, GeneXpert and BioFire, Hawi Sarapin, Hawi Saratsoni Apini. Ilanga Hawi Saratsa, Yoktan, Naluna Tolo, to Nuvajan, to Hamning, and Kamala, Alakito, Naluna Toga, Kanin Apini. That copying a suit, Peter Halang to Nuvajan, to Halang, and Maloilang, Hawi Sakta, Sulpia, Tawito.
To accurately detect the virus, high-risk contacts from the initial batch of tests have been re-swabbed to ensure testing is done at appropriate times during the incubation period. All those who tested positive and high-risk and non-critical staff contacts have been isolated. Critical staff contacts who are required to continue working for the safety of the other workers are doing so until they can be replaced. Those staff are following strict measures to keep isolated from those around them, including wearing masks. Workers who develop symptoms will be required to isolate immediately.
Tagapin Marion Kanayaki, Katiga Simayot Sule Kanaya Hatu at the Noctimili Tail Hunagasing Kanayaki, a Kanayaka now taking a bit along in Nini. Takwe Kanayaki, Maligali, as I go behind it to the Malik Tagal in Nikamalo, Katisi Daily Lutik Asliminik, Atuinaloki, Matuanik, and Malakanayaki, Hanui to Halito Takwa, Inutuga, Hatital Hatanato.
The rapid response team continues contact tracing and containment operations and are expected to be on site until the middle of next week. While the transmission of COVID-19 at the mine is concerning, the risk to Nunavut from this outbreak remains low. Hope Bay does not currently have Nunavut working on site, and there is no contact from the mine to any Nunavut communities.
Tako hila mi yukuto avum naktukui ikayoreati sulikati yaw si mayuni kawi sakpalya tut siya matayit silirlutillo amalo ni riyugi yaw yutay kanin ningin ni pinasoro siulak tumuno. Tako siya mapalya ning anuvadyo nak 19 o yaram na bimi isumalong nakalo atilugo uluraya na kutaw ning ano na vumiw no taman na at apasitok siya magayang ningani. Hope Bay o yaram na big man na yok no na vumiunik ikanayak to hangitok amalo katisi yokalaw sumangito yaram na bimi no na vumi no na lingin no.
Once the rapid response team concludes its work, my office will review the incident and information gathered by the rapid response team, From there, we will determine if there are enhanced or other measures needed to reduce the risk of another outbreak. In addition, due to increasing cases of COVID-19 in the South and ongoing concerns, beginning October 5th, all exempted workers traveling to Nunavut will be required to wear masks when outside their dwellings. Thank you.
An labbinga tan na khimik puila to tamakkuninga tukisiga utio yuni no ataw simayuni takununga kanaya simayunu no at sila tilugin aluna sila to takko hanuk kanyak malitaw yalin ni akit siga khala mangata uluga nak tumehuna git siya magundang ningano kakaninga gutako amisong panleaning in Nunavut jo nak tulit 19 khalunani amalo isumalun na panleato nak ninganot October 5 me takko ekanayak ti Nunavut mo panleayut atuin nakatagaya halaktun matuang ni tayo manggalimak ane nilimamin ni kuya nami.
And I should clarify that that's for the first, they need to wear the mask for the first 14 days after arrival in territory.
Duk sinaktigay ang luguta ko ulo ni 14 ni matuak si magaya hakayak tun na bumuto ako tik uya kang nakbin no.
Ken Driscoll, APTA National News. Dr. Patterson, the thing you were mentioning just at the very end about the exempted workers and the masks, wasn't it like that before? I'm wondering, what were the rules about the exempted workers? I was under the understanding that they did have to take certain measures. Was masks not one of them?
Ken Driscoll, APTA kunik luta Patterson takko pinakilap ti luta ko sa kakataka bitako kanayak ti tikigunak dito si mayo matuak si mayo nakaham ningin nun. The
wording was less clear. For healthcare workers, we were definitive that if you're at work, you wear a mask. For other workers and in other situations, it was more of when distancing can't be maintained, wear a mask, and that was hard to enforce and created confusion and still led to some situations that could have been risky. So we've just made it a blanket statement that if you're an exempted worker and you're out and about, whether at work or whatever, wear a mask for the first 14 days.
Tukisinat siya lang yung mata, tukisinat tigyak tituin na si Mayo Tako, ato'y nakatagay kalaw to galo, matuanik ikanayak sutik, asiminilo kanaya hatimini, kanit sa niya to ako ti, ato'y nakatagay kalaw to matuanik. Taman na nalulik ko tao si Malaw nga, taman na ulo kaya naktumila, kigo tao si Katalaw nga, tayo may mat, nalunak tao si Matsya makilik to Tako, angit tao si Mayo, kanaya kaya kung naksi Mayo, tayo mat, ato'y nakatagay niyalirayang ulo na 14
And Queen Amik for the interpretation. This is, Dr. Patterson, this is the first time you've sent out the rapid response team where it turned out there were actually cases. You had a dry run in Pond Inlet with false positive. Have you been able to learn anything about how that team's going to operate in the way if it does hit a small community? What have you guys learned from this TMAC operation?
Dr. Patterson, sibulla pamidako. Tuagang naktukoy kayo kaya aktuitako sibulla pami nalo na tayo yo hatilogo tay na tamma ko tawlaw si mamamit si matalim mi kisani ullo mi mulle kano elit si mavisi kano nunalin ni mikiyo taw na sanita man nawala nakakayang mga.
It's too soon to say. Right now they're very much the focus is operational, doing the test, trace, and isolate mechanism or mode, and after they wind down, then we'll go through the documentation and try to capture all of those lessons learned and then fine-tune our process from there.
Man nakilami ulo akto taman na kausay kaswara nga kisa nito kaga kalaki hatangata kaway sakta ulo lutik malukik kun ne katis yumini mga ta kaway sakta lekut inutuga hakti taw talekut Kisa ni tako piyaka palala tilugi de man tako no ala ta bukisuli ma to kisiga ko tiyo juta makko na lo na re kanerlugi khano ili ko tigi pala ko na mga atigo.
Jackie McKay, CBC News. The rapid response team at the TMAC mine, will they have to isolate once they leave that mine?
Jackie McKay, CBC pivalia yo connect tako hilami yo kika yo reactor yo TMAC ko yang na be mo sima yo Utiqata nittailige haqtitaulaqan.
Yes, they'll have to isolate at home for 14 days after they leave the mine.
Inutuge harneartu nittailige harneartu ulluni 14 ni uyaarnearbimmiingaalaortillugi.
CBC recently spoke to a woman staying at the disco who had an exemption to not isolate to come here to see a dying family member, who expressed concern about being able to wander through the community. Can you say exactly what mechanisms are in place to ensure that people who have exemptions are following their rules?
CBC uqaqatiqarsimammaatu yurmivimmiittuminermiig discovery mi isumaaluutiqarnerassuni taanne qinayarti tikititaussimajoq angertausimalluni atuqattaningimma matuammi qanu taakkua maligiaqallarittanginne qanu malittauqqartauqattaqa tamaungat angertauqattarti qinayariartu.
Right now, when you go through the process, you fill out the application, you sign the agreement that you will not go outside of your house, outside of those required times, like for work, and it's complaint driven. So when we get communication that somebody has been isolated and is not following the rules, we follow up with them to remind them about the obligations, and on at least 2 occasions we've had RCMP visit people to deliver warnings, and we're working on enhancing the enforcement process. I'll let Uli translate.
Maanau jotakkua pigaalitattillugi tatatisqaariaqasuungummata tutsirautimini tamaunga tikigumanerarsutik atiliurearrattangata imaang angerneraarsuti taakkua aniqattajaanginnerarluti angeqqaminni tamanna kisaani unnerluttuheeraimma taimaa qauisarunnakannersiqattarunnartugu tamakkua inuttu anittailigaaqartitauju malingittuminiutillugit qaujikkartaugiaqattartu iqqaititaulluti kisuni maligiaqarmangaata maqquarti palisikkunni upattitsigaaqattarsimajugut uqaujigiarturtitsilluta tamakkua malitsiaqullugu malittauqujausimayuni.
Mathis Harvey, Radio Canada. Can you clarify what criteria are used to consider to determine that a case is reported in Nunavut?
Mathis Harvey, naalausarjikkunni CBC kunni kisuni atoaqartaqareaqaqqatamakkua Nunavumuutuqarniartillugu.
Yeah, this is a little bit confusing. There's, in the formal national reporting system, the main thing, or one of the main things, is to ensure that no case gets missed. So every case of confirmed or probable COVID-19 gets reported to the national data set, and ideally no case gets reported twice. And the way that we do that is what are called rules of attribution, which jurisdiction reports the case. The rules are designed to help determine that. I'll let Uli interpret that part and then get into the details.
Tamannaila nalunagalamma nalleani nalunartaussimakattarniarmangaata nalleani avittorsimaviujuni kiseani kanatami nalunaersiqattartu tamakkua malittaugialinni qanu maqquarti nalunaertaujuqarrunagu nalleani avittorsimaviujuni taakkua nalunaertauginnahattareeli kanatalimaamu turaangajuni kiseani atuagaqarillutik nalleani turaangatitauniarmangaaq atuagartaharmimma melittaugialinni qanu namilo nalunaertaussimanearmangaa nalleani avittorsimaviujuni.
The rules have changed a little bit over the last 8 months from time to time, and right now most cases are being reported from the province or jurisdiction where the person permanently lives, but there is a clause that in the rules that requires some discussion between the jurisdiction where the case occurs and the jurisdiction where the individual lives, and some back and forth on that. And as long as both jurisdictions are clear on who's reporting, it's acceptable. In the case of the one Nunavut who contracted COVID-19 in the south, That individual had been there for 6 weeks, I think, when exposure and transmission occurred, so it was reported in that jurisdiction. What's going to happen with the individuals at the Hope Bay site, I don't know yet. That's to be determined.
Tamakko ato agaya sitsuk palya simamatatakkiw simayoni pingas sitamaoyok tuni mannaoyok tamakko nuvadjuanak nakaktaw yulima avittok simaviu yuni khallunani nalunertaw simakattaktot ammalo tamakko ato agarni nalunertaw simalluni tahakko akawi yaunneqat tabbani nunagingitangani nuvadjuanak taartumini uluni nunallaqingani nalunertaw simangaakattarmeyut tamakki avittok simaviu tukisiumakhatig itoaqqatik taanali nunavummiu tainna khallunani nuvadjuannartaalaorsimayo khallunani ilaorsimammat pinasaaqussirni 6 ni taunani ilaorsimamma taunani khallunani nuvadjuannar naasartausimangaalaorsimayo taanna houppeuyarnearpi pidjutigillugu suliqauyamangitavu nami nalunaatausimanniarmanga nalleani avittorsimaviu yimikkanatami.
Regardless of how all the attribution gets finalized, the important thing is transmission and acquisition of COVID-19 has occurred in Nunavut, and we're responding to our first outbreak that at least started partly in Nunavut.
Taana pidjutigillugu nalunaataw simakattarnaarmanga nanleano atittorsimaviu yuni naasartau qasiutiluni tamakko siammartauneqqat ubbalu nuvadjuanartaaneqqa tamani nunavummi naasartau qasiutigayartu taana sivullerpaami siarmarniuvalleama tamani nunavummi.
So does that mean that you don't know yet whether you'll consider that those cases will be reported here or in the province of residence of the employees?
Suliqauyamangilati tamani nunavummi naasartau qasiutinaarmangata ubbalu khallunani avittorsimaviu yuni naasartaugaarsimagayaqqa.
No, we don't know yet. The decision will be made between or after discussions between our team of epidemiologists and their counterparts in each of the home jurisdictions of the people who have positive results.
Mangitugu suli tamakko ukakatigigutawnartu tamanna nunavummingaarnerartawnarmanga ubbalu angeqqangani avittorsimaviu yuni khallunani taakko siarmartulirinermu piliriqatigit tamani nunavummiu tambalu khallunani atuni avittorsimaviu yuni ukakatigiinniartu taakko nami naasartausimagayarmangata.
Megan Dooling, Nunatsiaq News. For the recent Baffinland Nunavut Impact Review Board meetings, did technicians who came up to facilitate the meetings in Pond Inlet and Iqaluit, did they have to isolate before entering the territory?
Megan Dooling, Nunatsiaq pivalliayukkunni taakko Baffinland ku nuluyani nunavummi avatiliriyikku katimatitautillugi tamakko suurlu aajallirijingi ubbalu haqisaujallirijingi mitsimatalimmuursimayut inutuge haqtitaukai narsimavat tamaninluuni iqalunni tikilaunginninginni tappaani.
No, they didn't. The feedback that we got was that without those technicians, the meetings could not go ahead, that there was nobody in Nunavut who could do the work that they did, and that isolating for 2 weeks was, the NIRB would not have been able to get staff who could isolate for 2 weeks.
Agga taakko inutukei narahaqtitaulauнгитtu tappaunga tikilaunginninginni taakko uqaujaussimalauqatta taakko kamayingit katimane kayusigunnalangalauнгиммаггу taakko tikingippata taimaimma taakko maqquni pinasaaqusiinni taakko nunga nunavummi avatiliriyikkunnu iqqanayartinginni atuinnartaqalaungimma taimaimma taakko tikititaulu tikisiani katimagunna qayalaungata.
And so what advice did the Public Health Office give them in terms of cleaning the things that they touched and interacting and wearing masks and stuff like this?
Taanali annahannangittulirinnermu allabbi hanu malittaugalinni tilisiguti qalauqqasuurlu salummarsaingin naqattaqullugi attortalimaanginni kubbalu katisiluattailinnermu hanu tilissimaloqqigi.
We reviewed the general infection prevention or COVID control plan that the NIRB forwarded to us, and those workers got the exact same, they had the same requirements as every other exempted worker that they maintain distancing and separation when at work, and that they isolate themselves outside of work hours.
Thank you.
Takwa himek pula watigo takwa kati malatillugi parnautigi yang innovadjuarnaq tumisear martaunititsinaq mo parnautingit takwa eqanayarti taimaatsainaq maligiailinginnik takkunung inutuutail inutuugiahartitaungittuneq qanayartinut suurlu taimaatsainaq maligiaqalaortuut suurlu immikku qasuarsimainarluti eqanayarnermini ammalu anittailiqattarluti eqanayarnaugunniqaimma.
Emma Tranter, the Canadian Press. What has the contact tracing, the rapid response team learned about where this case originated, or have they learned anything about that?
Emma Tranter, takwa kayisartausima yukikkunni katisinang mga takano kayisima ba nakingar ng mga.
Nothing definitive yet. It's probably, at the end of the day, linked to the first 2 confirmed cases from a couple of weeks, 3 weeks ago, but how that happened, we don't know yet.
Gasolin nalo na ito sa mga ito kasi ito ka nga nakatuin na realita ko sa fulak pa mi makpo nalo na ito lang sa mayo pingasulak ti pinaswa ko sinasimalak ti kasi nalo na ito sa malaking ito kanok nakisang magbiw ng mga ito.
And because some of these individuals were symptomatic, how likely is it that these will come back as false positives?
Tako hanui ko hatu ya nirataw lang ng mata tako tamak si matuid na kahang mga ta kaya sa ko tingit sumabi.
I can't say 0, but really unlikely. Having 2 confirmed positives, now 8 presumptive positives, and a few of them having been symptomatic, and have all of these extra 8 turn out to be false positives would be, the chances of that happening would be vanishingly small.
O karon nang ito nga tayo kanulata tuwangan na kayangin mga ta tako makbo nalo na tayo law tilugit ang malusita mauyok to tako siyang makbiw si manirak tayo tilugit si bulak pa siuti nalo na tayo si matilugit tako alo ilang kanui guti hak tilugit nalo nang ito tako tamak si madangit nalo nang ito tamak ko ilang nalo na tayo lang ayun ubad jo ang maktukang ningin ni.
My next question is for the Finance Minister. Minister Hickes, one of the best tools that the government has had for preventing COVID from going from a mine site to a community is that Nunavut-based staff have been staying at home and earning 75% of their wages. Have the mines given you any indication how long they're willing to continue that program for?
Mr. Hickes, tako pilirijutit siya ng napango sa mata uyakar nerbe mo to nunalin nga tunit ikanaya kaya biyukat tangin mata tayo masaya maktaili titaw si mammat ang maluno na vumiyo ikanayak tiyo galo ikanayak at tangito 75% inikinaw dyan sa inikinaw dyan sa lutik kanutigita ko yung nerbe nalo na si mabata kanutigita man na kayo sinar mga.
Thanks for the question, Kent. I know Minister Akiag is more engaged directly with the mines. I do get updates from a couple of the mines when they do their extensions of how long they're going to continue paying. I can't remember the dates that they, or the chunks of dates that they go into, but I know I, for one, am very appreciative of that methodology that they're practicing right now, and I realize that, like our own costs, it's not something that can go on forever and ever, amen type thing, but I do. I'm sure I'll continue to get updated. I don't have a timeline, and they haven't specified a timeline to me.
Kaya namin kanta na minister ako yung nabin ni pilih hati ham naksa hatak tu galo kasi ni tako makpo yung nabi tu sabi hatak takalo abu kanu tigi akilak singin ng mga takinaw jet sa kaya unik tako ko yagit sa tako tay ko suli kinaw jet sa ngin nakilak sing mata tabong alima akilak sing jagun gunna jay yutsaw itu galo kasi ni nalo nang ito tu sakti taw gaya hatta lang ayo.
Premier Savikataaq, during your statement, you mentioned towards the end about all the steps that Nunavut need to take in order to keep up best practices to avoid contracting COVID. I'm wondering, are you going to be taking your plane back down south for the winter? And if so, what is your plan for isolating when you return?
Premier Savikataaq takwa kanile rote galinne malitaw galinne Nunavut me khaw sa khakhaw bitama na no ba joana tike khunago khangata yoge jaita na kyukku tawno khalluna no rote kanila khyo kamalo khano parnas mabe.
Thanks for the question. Yeah, the plane will be going back south, and the person flying it will do the 14-day quarantine.
Inutit.
Daan ting mihorat kabdanun uterner daan kangatayo endak taunung agyak taulun itan kangatayo ting mihorti taun 14 days into minachni ama uwangaw lang yun. Just actually I won't be piloting the plane. Thank you.
Jackie McKay, CBC News. Minister Hickes, please. CBC has been receiving a lot of photos from people in isolation hubs of moldy food they're receiving in those hubs. What is the government doing to ensure that's not happening?
Jackie McKay, CBC Kunik Minister Hickes tako go CBC ko jingwani takutitaw katangata tuyo mivini niriyaw katapto ni ukhsumayo ni government ko kanuiliog na katamatumong.
Thanks for the question, Jackie. And I saw a couple of the pictures that were reported, and frankly, it's unacceptable to provide moldy food like that. We have been working really hard to give people some choices and some options, providing country food with regards to the quality and sometimes how long before the food is delivered. We have had meetings with our staff, with the contractor, and with the general manager of the hotel, and they've put in additional quality control measures so that hopefully this won't happen again.
Tanataw tay kuninga jingwani takusimambiyok ima nakuyang natsertunik. Kisani tamanatay may gahangil lakimat nalira ko tihaktitaw hatakto surlo inulektaning atuid na viulutik ang malutak ko kaning ikalo mga taniriyaw nerto nalo nerto tsak kasakan ng nalakto kati makataw si malutik contractor si mayot ang malo tuyok mi vimmi manage nga.
Dr. Patterson, please. The NWT is considering bubbling with the Atlantic provinces because we're bubbled with the NWT. Is that something we would be a part of?
Luta Patterson tako nunat siya miut ima awla hatta hatigi gasawang nalang ata singin na kalunani tuni awla hatta bigigon na katigulo nunat siya miut taman na kano atoy ni kam na kawatino.
If the circumstances were right, yes.
Tay ma kano ingit siya ka kano igigayang itaka.
What can you clarify what those circumstances would be?
Well, I'm sorry.
Oh, nalito kisiyati kay nanga kana kisu sakit to kang kisu.
I'd just like to note that after 8 months, I finally had to remind Uli, not the other way around. That's a big deal. Sorry. That the cases stay low as they are, and that they continue to maintain their side of the bubble. And the last question is how we work the logistics, like how do you get from Atlantic Canada to Iqaluit reasonably safely. If we can work out all those logistics, I would support it. So it's in discussion, that's all I know at this point.
Apas ilahat sinaw to akatano ka joanak ta simayot tamakwalo taunani sang mapalya ngito akata kanolo akitaw si manang ipam na taw si maningit surlo kanataw kanan nang iningakto tamawe kalun no kaswak tilugit pag nataw si matsyak pataman na ikayok surayak ta kisani man nakakatigi ko taw balayok sule.
Mathieu Sarvé, Radio Canada. At the previous media briefing, you said you were considering to bring up positive swabs from down south in order to get the certification. How far are you from that option?
Mathieu Sarvé, Radio Canada. Kunita ko sumasaksyo ko tukam na kayo gabi tamak ko ako isa ko tiyo hatak to kalunano tutawiatod dangin matat kano tigi taman na kayo isa ko tik so itaman ato na lakan.
It's been discussed, but it may not be necessary the way things are going right now. The criteria for saying that we no longer have to send south for confirmatory results is 15 positive and 50 negative. Of the 4 operational devices in Nunavut, we're at or close to 50 negative for all of them, at or close to it. And we have at least 10 positives right now if they all get, or up to 10 if they all get confirmed. So we'll see how things look after this outbreak settles down.
Tamakko suli hakata valle mata suli aulaqtit sakata hakata khalluna kisani naluna tautsa kanne khullugit aulaqtit hakata harunni laaqtu taakko khawyisaqutingit 15nik naluna sisimalqatan nuvajjuarnartuqanginninginnik ammalu 50 kannernik nuvajjuarnartuqarninginnik naluna sisimalqata taakko sitamait aulata yohawyisaqutit 50 yung ataanoorsimalertu tamakko nuvajjuarnartuqanginnerartauyu kisani taakko khuliruttuinnariali taakkununga naluneertauyu nuvajjuarnartuqarningannik taakko tikiutini usangittu suli 50 no aippanga naluneertaukutinga nuvajjuarnartuqarutauningani.
Thank you. So just to clarify, is it 15 minimum per machine, per device, or total?
15 or 50?
50 negative, 15 positive, and that's for each device.
50 ulutik nuvajjuarnartuqanginnerartauyut ammalu 15 nuvajjuarnartuqarnerartau patay matakko khawyisaqutiin naloqqutigunnernerartaugayartu.
Megan Dooling, Nunavut News. Why are you saying that exempted workers have to start wearing masks outside of the house now?
Megan Dooling Nunavut takko inutuga kay nasimangiti qanayaqsimayo tamaunga summa ohastasinaleqimaan namatuarsimagaqalerningini.
Because the risk is rising as the numbers return again increase in the south, and because there's some confusion and just some people who don't want to follow the orders and look for loopholes, so we're making it as clear as we can.
Sivallearengat ammalo amisongo pallealutit nuvajjuanartuli khallunani tamanna nalulirutaw hattarsimalaungat ilangi malitsia hattartuugaloat ilangillu malittailinarmik khanu malittailigunarmangaamik khawyigasua hattangata tamanna tukisinartigialagiattuinartavutai maamatuarsimainnahina hattariaharninginni.
How many people came up to facilitate the NERB meetings? And how did you communicate that to the communities that they were in?
Hatsiulau kataako nunavumia patilerikkunno katimagiartu tikititau yutammalo khano taako nunali tusartisimalau khigi tikibbiulaarninginni.
I don't have a total number of people who entered the territory. I know that some isolated, some were in Northwest Territories and already in the bubble, and there were the 4 individuals who were approved for exemptions for the technical stuff, and there was communications with the communities that we had reviewed and endorsed their infection prevention control plan.
Hatsillatangum mga takawya mangitong atamaw ano na bumuti kilauktut ilangit inutuga hakay naktitaw hatta laukto sibongagut ilang ilunun at siya may nga law sutik tako sitamat ima katimayuni ulat sigartok simayut ikayo kayakto tako angyak taw laukto inutugay na kayakto titaw gatit amalo pagnaw tingin ni nunali tako tusak titaw simalaukto tikit to kalamningani.
Emma Tranter, the Canadian Press. 2 days ago, the Prime Minister announced that the federal government will be purchasing these rapid testing machines. Will Nunavut be getting any of those, or could we use those at this point?
Emma Tranter, Canadian Press. Good morning. Tako government ako naluna sila nga tako khilami yukko hawi sa kutsa yo Nunavut pikatawla katako nga hawi sa kutini.
Yeah, I think we will get our share of the our Nunavut share of that purchase will be made available to us. And the devices themselves, they have their uses. We just got to figure out the best way to use them in that's part of our overall system.
Nalo nang nito pikataw lakto go gapamata kakuning ato ni Nunavut tako new victaw sa mayo ni pikasiu jaw lakto tako how is ako tiyo kano ato nak sila mga tigo amalo kano akaw nang nakpako ato lang mga tigo suli nalo na kalakta.
Can you give us an update on the pilot project on testing? You were using charters to bring tests here to Iqaluit. Can you give us an update on that?
Ako tiga ako nakitigulo may mukano ilak mga tana uto ka tilo na kaya saktaw lokto hanga tatitaw yuk kano tikitit sa hatam na mga si kaya sakat sani.
Yeah, thanks. It was actually very successful. I think for the 2 weeks, all but one of the lab sample shipments got to the lab in Iqaluit within that 72-hour window, and most of them were a lot less than that. And so we're going to continue on with that, and we are going to expand it to have a plane in Rankin Inlet serving the same purpose for Kivalliq and Kitikmeot.
Taman na kayo sinahat sa atong makiulaw to dako na ni mako ni pinasa ko sin ataw sito tan na kayo sakat sa yo kayo sakbim mo paleyo kalon no kingo vaksimalawak to ila ikakani 72 ni tikigun nak sila to dako singi tikisakay na sa palo katalawak to taman na kayo sigo tiginak tabot amalo atoy na talang ayo hanga tayo mi kang sinak me tay maulak titagun nak to mi kiban lang mi kitang nilo.
Jackie McKay, CBC News. Just to clarify on Emma's question, the BioFire machines, so are those up and running for the territory now?
Jackie McKay, CBC Kunik, Takwa, how is a BioFire, Takwa, Aulane Hatsel, Katamani?
Yes, both BioFire, Rankin Inlet and Iqaluit have both a BioFire and a Gene Expert available for use.
Takwa tamaki kanga sinang me halon nilo takwa tu naulak taula ne khatsalak sutilo BioFire amalo Gene Expert how yesakoti.
And is there any recommendations for Nunavut for getting flu shots this season?
Atuli ko yisima vino na vumeo tayo ma kanimanang ito me kapayaw katakulugi.
Yeah, we want everybody to get their flu shot this year. Everybody who can. The flu shot will not protect against COVID-19, but it will reduce the symptoms that are, hard to tell. If somebody starts to get a runny nose and a cough, it's hard to tell without a test if it's flu or COVID-19. So preventing that is a good thing. And it also, if everybody gets the flu vaccine and it reduces the burden on the healthcare system, then it frees up staff to deal with COVID-19. So it's an important thing to get done this year.
Kikuli matseno na vumeo kapiyaw gali tamatuming kanimatay linaktumik tan na sa pumiyaw gut na jang ito galo no vadyo naktumut kisyani kanuingin naksaula kigutaw gunangat lalo na kayang atay ma kanimatuin ng mga ata o balo ni no vadyo naktuhang mga ata kisyani kikuli mano na vumitay ma kapiyaw patatay ma ana ham nang itulirigit piyat sa hang naksaw gayang at nuvad yung naktuliringar naksaw gunang at tamay ma din makiubo kapiya ko yilo ni tamak ko nga kaniman ang ito no na bumiulimani.
Just a follow up to that, because people are supposed to be avoiding going to their healthcare centers in person. How should people get their flu shots?
Tana ilagay kan nirlugutak ko ana bimok tayo linak ila na mo tayo kuyaw katang katakan ulit ako kapayaw katakon na lang ang mata.
Each health center will have to will be able to set that up for what works best in their community, and it may mean either clinics outside of the health center or set periods, set clinics, flu shot clinics. So there's a variety of options available in each community.
Ato ni nunalid ni anak biyod imini akit sigur nakto kano akaw nakpang mga sulan na biyo ilo ni ugi atong ito kapayaw katang nakto hangak ko na mga kitsigun nakto na milu kapiyaw hatak to hang na mga singin nalira ko tini nalira ko to hakon nakto.
Ken Frisco, APTN National News. This might be the least important question you take today, Dr. Patterson, but I've been asked to ask it. Are we going to be able to have trick-or-treating in Nunavut at the end of the month?
Ken Frisco, APTN kumnita na pimarayong inakpango yut soya perinaktara pero kuyaw si mamagor tako Halloween utilugi kumiagang nek ima pulagaw to hakon nalakan.
It's an important question. It's maintaining normal life for our children, which is what I think most of us want or consider a priority. And so, yes, we trick-or-treat, as long as things stay the way they are, it's safe for trick-or-treating to continue. We will produce some guidelines, and including for communities like Aviat, allowing for decisions to have some degree of indoor trick-or-treating so that we don't put kids at risk of polar bear attacks.
Dan nalipin Mario ya pekutigi ya ita ma sorusi pero pala ningin kano ite lekuna katigo. Pula kakata kun na lang ayot at tanang ito akat takwala kitsena ato agang ni malitaw galindik surlo via me ismali ko taw katalang pingwa beilo ani ita ma Humegang nito na yung kaktaw katak sa teksulo, nanoktaw na yung matatay matag pangnaw to hakon nakta to nino nalay.
But just to be clear, that's assuming that there's no worries about transmission of COVID-19 in a community. So we'll keep our fingers crossed that we can stay the way we are for October 31st.
Tay ma isumanaktaw ta ko ser maksima yung hangito akano na ila. Novadyo adak 90 mig tay ma isuma gintuin nam na akta po tay ma ikaw nago October 31 ngulakat.